Hi, my name is Charity Day Phillips, and this is my larynx. So from this angle, you can see your hyoid bone, your thyroid cartilage, your epiglottis, your cricoid cartilage, and the start of your trachea. So I'm going to go ahead and remove our hyoid, get her out of the way. It is actually the only freestanding bone in our body. I'm also going to remove this portion, which is representative of our vagus nerve, which is the nerve that innervates all of the muscles of the larynx, as well as specifically the recurrent laryngeal nerve of the vagus nerve. So we're going to shift our model this way, and from this side you can still see your thyroid cartilage, your cricoid cartilage, part of that trachea, and then also these muscles. So this muscle is your thyroid cricoid muscle. It actually is meant to tilt the thyroid up and down, as well as this red one. This red one is your inferior cricoid arytenoid muscle. It connects the cricoid to the bottom portion of the arytenoid. When we shift it this way, you can still see our epiglottis from this view, the back portion of our thyroid, our arytenoids, and our cricoid cartilage. This yellow muscle is our posterior cricoid arytenoid muscle, which is our only abductor, so it's the only muscle that takes the vocal folds apart, while the rest adduct, which bring them together. And then also you can see the interarytenoid muscles, which are your transverse and oblique muscles. Those are meant to tilt our arytenoids in and out. And then when we shift the view this way, you can see your thyroarytenoid muscles or your vocal folds. You have true and false ones. And these do move. I just have very fat fingers. Just want to make sure you see that very well. So, the way that a larynx works is you build up a bunch of pressure underneath the vocal folds. So you get this subglottal pressure is what it's called. So all this pressure builds up, and once enough pressure comes up from your respiratory system, they eventually separate the vocal folds in a wave-like pattern, and they come together super fast, creating a voice. So that pressure eventually opens the vocal folds, close them back again, giving you your voice. This portion right here, your epiglottis, is actually used to protect the airway during a swallow and feed, and like during feeding. So when you swallow, these two touch, and this goes back. So essentially, it's a quick motion of together, back to protect the airway. At rest, the vocal folds are open to allow air to go into the lungs. And that is how your larynx works. Thank you.